Diabetes affects every organ in our body, including our nerves. Over time, high blood sugar levels can cause damage to our nerves and can cause significant problems and complications for people with diabetes. You may already know a diabetic who has amputations or missing limbs because of their diabetes, unfortunately. On today's episode, we are going to talk about what is diabetic neuropathy, how do you prevent it, and how do you protect yourself if you do have diabetic neuropathy. Before we get started, if you are new, please consider subscribing to my channel. If you're enjoying the video, please give a thumbs up, comment below, and of course share this with your family and friends that might find this video useful. Over time, high blood sugar levels can cause damage to our nerves, and normally this will start in the toes and feet, but it can move up to the legs and even the hands at times. We call it diabetic neuropathy when nerve damage occurs because of diabetes. Here are some signs and symptoms of diabetic neuropathy: numbness or loss of feeling, burning or pain, which is often worse at rest or at night, tingling, and feeling light touches as bothersome or painful. Some of my patients will complain that even the lightest touch from their bed sheet will cause significant pain, keeping them up at night where they are not able to sleep. There are tests that we can do to see if someone has diabetic neuropathy. So normally if the patient is complaining about such symptoms, I will perform an exam in the office to see if their sensation is intact or if it's not. And we can also send patients for nerve conduction tests as well. We can see how well the nerves are working. Why is diabetic neuropathy a problem? It's a problem because people can feel with their feet. So if you get a cut, you can feel it and you can take care of it. When we have diabetic neuropathy, we lose sensation, unfortunately. A lot of people will get cuts and they don't feel it. And what will happen is that cut becomes infected and it can travel to the bloodstream. And this is why some people end up getting amputations. Even a minor cut can become such a problematic. With diabetes, the healing takes longer and it's more complex than someone without diabetes. So even the most minor cut can be such a problem, especially if you miss it and you don't see it on time. For this reason, diabetic neuropathy is a very serious condition and needs to be managed by a doctor, and you should be seen by a podiatrist as well, who manages and can cut your toenails and can inspect your feet on a regular basis. Here are some things that you can do if you have diabetic neuropathy. One is obviously you can control your blood sugar levels. We know that the tighter we manage our diabetes and the more in control we have our blood sugar levels, we are less likely to have complications of diabetes, including diabetic neuropathy. You want to make sure you're taking very good care of your feet. You're inspecting your feet on a regular basis. I tell my patients to have a mirror if they don't have someone at home with them, and they can literally look in the mirror to see if there's any cuts or anything that they may have had on during the day. And of course, that needs to be addressed right away. You want to wear shoes or slippers at all times, even inside the house. You never want to go barefoot. You want to trim your toenails very carefully. You want to cut straight across and file the nail. Do not cut cuticles or pop blisters. Most of my patients are being followed by podiatry on a regular basis, so I tell them not to cut their own toenails, and they have a specialist who actually cuts their toenails, which is a much safer and a better way of managing diabetic neuropathy. You want to make sure you wash your feet with warm water and soap every day and pat them dry. You want to put moisturizing cream or lotion on the top and bottoms of your feet. And of course, you want to look for cuts, blisters, any swelling or redness. You want to make sure you check all over your feet, including between your toes. You are wearing socks that are well fitted. You don't want them too tight where they can block circulation. You want to make sure you're wearing clean socks and changing them every single day. Inspect the shoes before you wear them. Make sure there's nothing inside, like sharp objects that can cut or cause any harm to your feet. The best thing is obviously to prevent diabetic neuropathy. The way you do this is by keeping your diabetes under very tight control. You want to make sure that you are not smoking. If you are a smoker, you want to make sure you quit smoking, because we know that that will further complicate diabetes and also diabetic neuropathy. You want to make sure you're eating healthy diet and getting plenty of physical exercise and losing weight if you are overweight. I hope you enjoyed this video, and I'll see you on the next one.